Chapter 47, Endocrine System Introduction. Little review. The endocrine is composed of glands, glandular tissue that make, store, and secrete chemical messengers we call hormones. The endocrine gland is also called the ductless system because there's no ducts, right? Endocrine works by those hormones are being secreted. The hormones is going to travel into the bloodstream and it's going to what we call target organs. Okay. Organs of the endocrine system is in page 912 in figure 47.1. So you have the hypothalamus, the pituitary, the pineal gland, thyroid gland, parathyroid, thymus, adrenal gland, pancreas, ovaries for the female, and testes for the male. The release of hormones is in response to the body's needs, and it's responsible for a lot of things like reproduction, fluid and electrolyte balance, host defenses, responses to stress and injury, energy metabolism, and growth and development. And the main goal is to maintain homeostasis. And how is the endocrine system maintaining homeostasis? It's using two feedback mechanisms, either negative feedback or positive feedback. Negative feedback is very interesting. It's kind of like a thermostat in the house. So if you set the temperature of the house to 75 degrees and it gets to that level already and the house is warm already, um, because there's an increase of that warm air, then the thermostat is now going to inhibit, right, or stop blowing that warm air so that it could stay in that level. And that is how negative feedback is. So when there's an increased substance in the blood, for example, there will be an inhibition or decreased secretion of the hormones. And then for your positive feedback is the other way around. When there is an increased substance in the blood, then there will be an increased hormone synthesis and secretion. Whereas if there's an decreased level in the blood, there will be a decreased hormone synthesis and secretion. So it's just based on what hormones we're talking about and what glands is actually um, is responsible. Okay, the pituitary gland. For pituitary gland, there is the anterior and there's also posterior pituitary. Okay, so for your anterior pituitary gland, you have 1, 2, 3, 4, 5, 6, 7. Okay, it's regulating and it's secreting 7 hormones. What are they? Your growth hormone or somatotropic hormone, adrenocorticotropic hormone, your ACTH, thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, prolactin, and the melanocyte stimulating hormone. Whereas your posterior pituitary is responsible for the antidiuretic hormone and the oxytocin. Okay? Okay. So, let's start with the growth hormone. So this is the pituitary gland, right? Pituitary gland, right? Okay, so let's start with growth hormone. Okay, growth hormone is coming from or being released from the anterior pituitary, right? Let's start with anterior pituitary, the one with 7 hormones. Okay, so first one is your growth hormone, or we call it somatotropic hormone. This one stimulates the growth and development of bones, okay, bones, muscles, right, and organs. Okay, so growth hormones, they stimulate also the what we call IGF-1, is insulin-like growth factor. This is by the liver and other tissues, and this one promotes tissue growth. Okay, so the growth hormone is actually stimulating the release of, stimulates meaning it's like telling another organ, right? In this case, it's telling the liver and other tissues. For example, this is the liver plus other tissues. Okay, it's stimulating them and telling them you gonna release, you gonna have to release this insulin like growth factor, or what we call IGF-1, right? And what this IGF-1 is doing is it's promoting tissue growth. Okay, in addition to that, the growth hormone is actually also responsible for, of course, the growth of the bones. Okay, another thing is the growth hormone is also responsible for mobilizing stored fat for energy. And what does it mean? It means if the body is actually um, starving for that energy, what it does is those stored fat in the body, the growth hormone is actually helping for the mobilization of those stored fat so that we can use, or the body can use it for energy. Okay, I'm just talking about the functions of growth hormones here because we have to understand the functions of the hormones for us to understand when we talk about the disorders later on. Okay, all right, that's for your growth hormone. Next is the ACTH, or what we call adrenocorticotropic hormone, or ACTH. This is still coming from the anterior pituitary gland, and it's controlling the function of the adrenal glands. Okay. The adrenal glands, if you recall, is the triangular glands that is sitting on top of the kidneys, right? And then this adrenal gland here has a cortex. So cortex is the outside part, right? And then in the middle is actually what we call the medulla. So this is the cortex, okay? And this is the medulla. All right, so let's go back to the hormone. ACTH, or adrenocorticotropic hormone, is being released from the pituitary gland. Now it's going to the adrenal glands, and it's controlling the function of those adrenal glands hormones. So in the adrenal glands, there's going to be a release of what we call glucocorticoids. Okay, glucocorticoids. Okay, and adrenal androgens. Okay, but let's go back to the glucocorticoids. So your glucocorticoids are what we call cortisol, right? Or the aldosterone. Okay, This is in the cortex, adrenal cortex. Adrenal cortex. All right. So, what is the function of this cortisol and the aldosterone? Remember your cortisol? This is an anti-inflammatory, right? Anti-inflammatory response. Plus, also when the person is under stress. Okay, so it's actually for stress response. All right. So what happened is that when there is a stress or a constant stress, then there will be a release of the cortisol. With the release of the cortisol, um, let me move this forward here. Aldosterone. Okay, when there's a release of that cortisol, if you guys recall, there was also going to be an increase gluconeogenesis is what we call it. This is to maintain the glucose in the body. That's why when you're under stress, remember, your cortisol is gonna go up and then your blood sugar is gonna go up. Even the medication, when we give those medication that's actually mimicking this hormone cortisol, is actually creating this gluconeogenesis, therefore increasing the glucose in the blood. All right, more function of the cortisol is the excitability of the myocardium. Um, and then also again an anti-inflammatory, and but because of this anti-inflammatory effect of the cortisol, that actually um, has some effect on the immune system. So what it does is it's kind of like telling the immune system, hey, calm down a little bit, because I'm having I'm having a lot of inflammation here, so you gotta calm down a little bit. So what it does is it decreases the immune system. That's why when you have an increased cortisol, increased stress, your immune system goes down. And because of that reason, now when the increased cortisol is happening, there's an increased stress, there's a decreased immune system. Now my patient is going to be at risk for infection, right? Okay, I'm just piecing the pieces together. Okay, I'm just putting the pieces together so it makes more sense. All right, now let's go to aldosterone. Aldosterone is now responsible for the reabsorption of sodium and increasing the excretion of potassium. Okay, so just remember the function of this ACTH for now, so that when we talk about diseases later on, it will make more sense. All right, again, ACTH right here is coming from the pituitary gland, and then oops, it's coming from the pituitary gland, adrenocorticotropic hormone, and then from the adrenal glands in the outside part, which is your cortex, right? The adrenal cortex is the one that's responsible for the secretion of what we call, or production of what we call glucocorticoids. Your glucocorticoids is your cortisol or your aldosterone, right? Your cortisol, I just did talk about the functions of cortisol here, so it kind of make more sense when we talk about cortisol later on. And then your aldosterone also is responsible for this reabsorption and excretion of these electrolytes here. Okay, next we have the TSH. TSH, or the thyroid stimulating hormone. Thyroid stimulating hormone. And this is still in the anterior pituitary gland. Okay? Now, the thyroid stimulating hormone is responsible for the secretory activities of the thyroid gland. Okay, the thyroid gland is responsible for the regulation of metabolism, regulation of the rate of metabolism. Okay, rate meaning how fast, right, is the metabolism of a person. That's why when you have your hypothyroidism, you have a slow metabolism. You have your hyperthyroidism, you have that high or fast metabolism rate. Okay, now from your thyroid gland, it's also responsible for T3, right? Or the other name is triiodothyronine. Okay, this is T3. This is hormone that's coming from the thyroid gland now. Okay, and then your T3 and then your T4 is what we call thyroxine. Okay, and these two hormones are working together to control or regulate the metabolism, the body's energy use. Okay, another function of the thyroid is the regulation of calcitonin. Now, what is calcitonin? It's very important for us to remember this hormone right here that is coming and being regulated by our thyroid gland. The calcitonin is actually responsible for the regulation of calcium. Okay? What is calcitonin doing to the calcium, or how is it regulating the calcium? Here's how it is regulating calcium. So, for example, this is your blood vessel, right? And in the blood, you have calcium, right? Now, for example, this is your bone, right? And of course, there's calcium. All right, so what's happening is when there is an increased calcium here in the blood, there's a lot of calcium, 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 calcium. The thyroid gland is going to secrete that calcitonin. Okay, there's going to be an increased calcitonin. And what calcitonin is going to do is to increase the excretion. Number one is increasing the excretion of this calcium to the body, right? Or from the body, I'm sorry. Excretion, increase excretion, so it can decrease the calcium. And then it's going to tell the bone marrow now and say, hey, bone marrow, I have a lot of calcium in the blood right now. I need you to actually stop releasing calcium for now, right? It's inhibiting this, stopping this bone marrow to actually release calcium to the blood. All right. It also slows the absorption of those dietary calcium in the GI to make sure that. Okay, next is TSH, or the thyroid stimulating hormone. Thyroid stimulating hormone. And again, this is still coming from the anterior pituitary, right? The anterior pituitary. Okay, this TSH, or your thyroid stimulating hormone, is regulating or controlling the secretory activities of the thyroid gland. Okay, now the thyroid gland is responsible for regulation or regulating rate of the metabolism of the body. Okay, so that's why when you have a hypothyroidism, you have a slow metabolism. When you have a hyperthyroidism, you have a fast metabolism. Right, makes sense. So for your thyroid gland, this is responsible for T3. Okay, in the thyroid gland, T3 is being released. T3's other name is triiodothyronine. Triiodothyronine. Okay, and then also T4, which is your thyroxine. Okay, and these two hormones are actually helping each other to control the regulation of body's energy use, or the metabolism. Okay, in other words, this T3 and your T4 are the ones that's actually working together, and this is being released by your thyroid gland, and this is working together for metabolism. Regulates the heart rate, respiratory rate, heat production, and all of those things. Now there's one hormone that I would like to talk about also for from the thyroid gland, is your calcitonin. Okay, now what is the function of calcitonin? Calcitonin is a hormone that helps the homeostasis, or the of calcium, balance of calcium in the blood. Or let's put it here, so it's, oh, let's put it here. This is regulation of calcium in the blood. Okay, balance of calcium. All right, so for example, this is the blood vessel, right? For example, that's the blood vessel, and then you have thyroid gland, and then this is the bone, for example. Right, the bone has a bone marrow, right? And the bone marrow is the one that's actually producing all of those cells. So here's what happens. Calcium is being stored in the bone marrow, or in the bone, and then you have also calcium in the blood. So here's what's happening, and here's how calcitonin works. When there's an increased calcium, for example, a lot of calcium in the blood, this is the blood vessel, okay? So the thyroid gland is going to say, hey, what's going on there? Why is there a lot of calcium in the blood? What we're going to do is, I need to increase the secretion of this calcitonin, right? Because calcitonin is the one that's actually balancing the calcium between the blood and then the bone. Okay, so when there's an increased calcitonin, what's going to happen is, number one, this calcium excretion is going to be increased. Okay, like the kidney is going to actually increase excretion. So calcitonin is like, I need you to actually get out of that, the body, right? So there's going to be an increased excretion. Another thing is that it's going to tell the bone to actually inhibit from releasing the calcium, because the bone is the one that's releasing those calciums, right? Right? Okay, so now calcitonin is saying, hey, there's a lot of calcium in the blood right now. I need you to stop this right now, and inhibits it. Okay, bone marrow. All right. Now, another thing that calcitonin is going to do is it's going to slow down the absorption of calcium in the GI. So those three things. But basically, point is that the calcitonin is trying to balance out the calcium in the blood and in the bone. Okay, so if there's an increase here in the blood, now it's going to do all of those things, and then it's going to inhibit the bone from actually secreting those calcium into the blood, to make sure there's like a balance, right? Okay, still in the anterior pituitary gland. Okay, so quickly, you have a what we call follicle stimulating hormone. Okay, follicle stimulating hormone, or FSH. The FSH stimulates the development of the eggs. Development of the eggs in the ovaries. In ovaries. And estrogen production in the women. And estrogen production. So let's just put estrogen production. And then this is for the women, right? For men, FSH is responsible for stimulation of sperm production. Okay? All right, now let's go over more from your anterior pituitary gland. You have what we call luteinizing hormone. Luteinizing hormone, or LH. It controls progesterone production and ovulation, or egg release. So if your follicle stimulating hormone is stimulating the development of the eggs in the ovaries, the luteinizing hormone is actually the one that is responsible for the stimulation of the egg release. Okay, egg release. Also controls progesterone. Let's put progesterone. Progesterone. Okay. All right. Now, luteinizing hormone for men is responsible for testicular growth, and the production of testosterone. Testosterone. Okay. All right. Now let's go over, still in the anterior pituitary gland, is your prolactin. Okay. And what does prolactin do is it stimulates breast milk production. Okay. All right. Now you have your MSH, or what we call melanocyte stimulating hormone. And this one is the pigmentation of the skin. Promotes pigmentation of skin. Okay. And we have completed the 7 hormones for the anterior pituitary gland. Now let's move forward to posterior pituitary gland. Okay, now let's talk about posterior pituitary. Posterior pituitary gland. Okay, in the posterior pituitary, there is 2 hormones, your antidiuretic hormone or your ADH, antidiuretic hormone, and this one causes reabsorption of water from the renal tubules of the kidney. And because of that, water excretion from the body in the form of the urine is decreased. So your urine is decreased. Okay, urine is decreased because of the reabsorption of water from the kidney. Okay, now the other one is oxytocin. What does oxytocin do? Oxytocin causes contraction of the uterus. Now this one, the target organ is the uterus. It's helping the uterus contractions of uterus. So this is helpful. Your oxytocin is helpful during labor, right? Because the uterus needs to contract for the baby to come out. So this is actually helpful during labor. And another function is the release of breast milk. Okay. Now, don't confuse this with the prolactin. Prolactin is the one that stimulates the breast milk production, and the oxytocin is the one that's actually helping with the release of the breast milk. All right, again, just a review. Your adrenal gland, there's a cortex and medulla, right? Adrenal gland, there's a cortex and the medulla. The outside part is the cortex, and the inside part is the medulla, right? Again, in the cortex, there's your mineralocorticoids or glucocorticoids, which you did talk about, your cortisol, and then you have the androgens or the sex hormones too is in there. In the adrenal medulla is your epinephrine and norepinephrine. And then the thyroid gland is the one that's regulating the body's rate of metabolism and growth and development, and it secretes those hormones that we did talk about, your T3, your T4, and the calcitonin, which regulates the calcium. Then we have the parathyroid hormone, or we call it also parathormone. Your parathyroid is located in the back, embedded in the thyroid gland, right? Usually there's 4 parathyroid gland that is embedded in the thyroid gland, and they secrete one hormone, which is what we call the parathyroid hormone right here. And this parathyroid hormone is very important with the regulation of calcium in the blood. Okay, now it's the opposite of your calcitonin, right? We did talk about the function of the calcitonin earlier on. In the parathyroid, this is how it's regulating the calcium. So this is the blood vessel, right? This is bone. Let's say this is the GI, the intestines, right? What happens is that when there's a decrease calcium in the blood, right? For example, calcium, calcium, calcium. All right, the parathyroid hormone, gland is going to secrete parathyroid hormone. Okay, that parathyroid hormone's function is to make sure that that calcium right here is being regulated, and there's going to be more calcium here because now it's detecting there's low calcium in the blood. We have a hypocalcemia here. All right, so parathyroid gland is going to secrete that parathyroid hormone, and what it's gonna do is now it's going to communicate to the kidney, right? Oh, that doesn't look like a kidney at all. Um, so the kidney, and it's gonna tell the kidney, hey, can you conserve calcium? I don't want you to actually excrete calcium that much. Okay, we need to save them because there's a low calcium in the blood. Okay, that's one. Right? Now, in the GI, it's going to tell the GI, parathyroid is going to tell the GI, can you increase reabsorption of the calcium? Because I need more calcium here in the blood. It's low, right? So GI is now going to increase the reabsorption of the calcium. And then it's going to tell the bone now, it's going to tell the bone, can I transfer calcium? You know how this calcium in the bone is going to tell the bone, I need to transfer some calcium from you, bone, to the blood because I need to increase this calcium in the blood. Okay, so that those are the functions of the parathyroid hormone. And then we have the pancreas, which is an exocrine functions. So what is exocrine? If you guys recall, if we're talking about exocrines, exocrine meaning ducts, right? Okay. Everything is through ducts. Okay. Those enzymes in the pancreas are being secreted in the ducts. Um, those whatever it is that is actually being secreted in the pancreas is called exocrine because it's coming from the or going through a ducts. Okay, what is age related changes for older adults? So in healthy older adults, the endocrine function remains adequate. There's not much changes, right? There might be some diminished response to the antidiuretic hormone. Remember that if there's an secretion of antidiuretic hormone, your urine is decreased, right? So if a diminished response to the ADH, what's going to happen to the urine? It's going to be the opposite, correct? All right, then there's a decline in growth hormone and the insulin growth factor that we did talk about earlier on. There's a decrease in cortisol secretion, decrease in aldosterone secretion, and then there's incidence of hypothyroidism increases with age, especially among women. Okay, assessment. We need to remember Shvostek and Truchot sign. If you look at page 921, Shvostek and Truchot, this right here, Shvostek and Truchot sign, they are signs of hypocalcemia. Okay, of hypocalcemia. Okay, it means low calcium in the blood. Okay, so what is Chvostek's sign? Look at letter A. Okay, look at letter A in figure 47.4 in page 921. Chvostek's sign is when they tap the side of the face, the facial muscle is there's going to be a spasm of the facial nerve. So the patient is actually going to, squint that side of the eye, side of the face. Okay, so in that picture you can see it that they were tapping the left side of the face, and then the face is actually like winking or squinting like that. Okay, and then for the Trousseau sign, the letter B, if you look at it, this is a carpal pedal spasm that occurs when we actually inflate a BP cup above the patient's systolic BP. And then we left it in place for 2 to 3 minutes, and then it's going to like curl those fingers inward like that in that in that picture. It's called a Trousseau sign, and that is an indicative of hypocalcemia or low calcium in the blood. Okay, diagnostic procedures and tests. You can actually read through this. Very important for us to know, especially the preparation. We have to know the preparation and the post procedure for this diagnostic study. Um, Here, let's go over it. It's in page 914. Highlight CT scan, cerebral CT scan, the MRI, growth hormone stimulation. Again, look through the patient preparation and post procedure. The blood studies for cortisol, aldosterone, ACTH. Um, in the next page, you can highlight the thyroid scan, highlight serum T3 and serum T4, very important for us to know. And then serum thyroid stimulating hormone or your TSH, know them too. And then in the page 917, the bottom one where it says blood studies, highlight that parathyroid hormone and serum calcium total. In the next page 918, read through the pancreatic studies, which is the fasting blood glucose, oral glucose tolerance test, and the hemoglobin A1C. We need to know these things. Also, glucose for the urine, glucose screening test for diabetes mellitus. So read through this box, very helpful for us. So drug therapy for endocrine disorders, of course, this is hormones. So if there is not much that is being released, then we have to replace it, right? And if there's a lot, then you have to actually suppress it. Simple as that, right? Okay, in page 922, table 47.2, please read through these medications and know the use in action, side effects of the medication, and nursing intervention. Okay, so it's the table 47.2 from page 922 up until 927. Obviously, like we said, if it's a thyroid replacement drug, I just want to point it out. Like in page 924, your levothyroxine or your Synthroid. This one treats hypothyroidism and thyroiditis. So this actually is a replacement drug that we actually have to give to the patient for lifelong therapy, right? We, as long as they live, they have to take this. So know the use in action, side effects, and nursing interventions. Okay. For diabetes, we will actually talk about that in the next chapter. All right, and that is it for chapter 47.